a patient, we'll call him Mark, who was referred to me for back pain. He had already had a spinal x-ray and MRI done, and before we had barely said hello, he handed me the MRI report and said, "This says I need surgery." Now, Mark, who was in his late 20s, had been dealing with back pain for the better part of the year. It had started out as a simple annoyance, but was now becoming much more constant and worrisome. The MRI report noted some facet hypertrophy without spinal canal stenosis, and the assumption was that this must be the reason for his pain. He also thought I was an orthopedist who could do surgery, so we had a lot to discuss. So first off, I clarified for Mark that I'm a rheumatologist, not an orthopedist, and although I can help figure out back pain, I don't do surgery. So then we got into the juicy part, which was his back pain. I put the MRI report aside and I started asking him much more detailed questions about his pain, because that report and what it says is only as helpful to me as the information I'm able to bring to it. You see, back imaging reports are full of findings like these, especially as we get older. I explained to him that terms like facet joint hypertrophy, where the vertebral joints get a little knobby, can sound alarming, but sometimes it doesn't lead to any symptoms at all, especially when there is no spinal canal stenosis, as his report noted. After we dug deeper into his pain, I could see why he was referred to me. It wasn't because of his MRI report. It was because his pain sounded inflammatory, and we needed to think about conditions like ankylosing spondylitis. AS is an autoimmune inflammatory back condition that can cause many to have back pain, especially those that seem too young to have back pain. The diagnosis of AS can be tricky and is more involved than I have time to get into here, but a key piece of information is imaging. But not the imaging Mark had already had done. That was just of his lumbar spine. We needed imaging of his sacroiliac joints, which are in the pelvis, and often they're not caught when imaging is just done of the lumbar spine. So what can we learn from Mark? Well, number one, understanding what your back x-ray or MRI report says and what it doesn't say is crucial when deciding what are the best next steps. And two, findings on either a back x-ray or MRI are very common and not always the reason for your pain. And then three, not all back pain is the same, and understanding your pain will help you and your doctor interpret the x-ray and MRI results. And rheumatologists and orthopedists are different and bring completely different skill sets to the table. And have a great day.